use and the effect of TDCS on the treatment of auditory verbal hallucinations has been described precisely with references to past and present literature. Schizophrenia is a chronic mental health disorder characterized by dysfunctions in the perception of reality, emotion, and cognition. Clinical manifestations include positive symptoms such as hallucinations, delusions, thought disorders, and bizarre behavior, while negative symptoms include as affective flattening and attention impairment. These symptoms are associated with dysregulation of several neuromodularity transmitters and have negative impacts on an individual's physiological functioning that leads to pathological alterations of cortical activity and plasticity in the brain. TDCS was used to treat auditory verbal hallucinations in schizophrenia in a 37-year-old female with a persistent auditory verbal hallucinations that were non-responsive to antipsychotic medications over 11 years. TDCS treatment was administered with the anoid placed in the middle of the electrode over a point midway between the left dorsolateral prefrontal cortex and the cathode located over a point midway between the left temporal junction. After stimulation was given at 2 mA for 20 minutes with 2 sessions at 3-hour intervals. The results after 3 sessions showed a significant reduction in attention salience for auditory hallucinations, reduced stress, and improved mood. After 20 sessions, further improvement was noted from a baseline auditory hallucination score of 35 reduced to 24. Used a randomized double-blind sham control study to test the effects of administering TDCS once a day with stimulation over left frontal and temporal areas to reduce auditory hallucinations in patients with schizophrenia. Results from TDCS being administered for 5 days indicated a significant reduction in auditory hallucinations recorded by the Auditory Hallucination Rating Scale. Researchers have provided support for various hypotheses to explain the influence of different physiological mechanisms involved in schizophrenia. There has been support for temporal lobe activity, which can cause vivid experiences of autobiographic memories. Different artificial stimulation of neurons within the nervous system can induce different hallucinations. Hippocampal activation is associated with the actual experience of auditory or visual hallucinations alongside with the activation in higher order neurocortical areas. Hippocampal hyperactivity might underlie hallucinations and other positive symptoms in schizophrenia. Supportive findings also indicate the lateral entry of activity arising autonomously from pathological changes activates intermediate order of neurons, which misdirects the route of normal sensations throughout the nervous system and invoking hallucinations with a compelling sense of reality. There is a decreased activity which is relative to dorsolateral cortex, right cortex, and nucleus of the thalamus, and increased activity in language including the bilateral inferior frontal. Hallucinations were reported to be associated with increased activations as well. There is a decrease and increase in dopamine transmission in subcortical and cortical regions respectively. The linked hypothesis to delusions and schizophrenia to dopamine suggests unstable glutamate hypothesis was focused on the neurotransmitters and reduced function of NMDA glutamate receptor. Glutamate blocks drugs such as penicillin and ketamine, which can mimic the symptoms and cognitive problems associated with the cognition. Levels of parabluvin protein and mRNA were found to be lower in patient brains in various regions of the brains. Actual numbers of parabluvin interneurons have been found to be unchanged. Parabluvin interneurons are somehow specifically unaffected in the disease. Further studies have indirectly pointed to neuron dysfunction in schizophrenia. There is a consistent observation of decreased presynaptic terminals in the hippocampus and a reduction in dendritic spines in the prefrontal cortex. There is an increase in stratal spine densities which seem to be independent of antipsychotic drug use. TDCS is a non-invasive painless brain stimulation treatment that uses direct electrical currents to stimulate specific parts of the brain. A low-intensity current is passed through 2 electrodes placed over the head which modulates neuronal activity. 2 types of stimulation with TDS, anodal and cathodal. Anodal excites the neural activity while cathodal reduces neuronal activity. TDCS alters cortical excitability for up to hours after the end of stimulation. Depending on its duration and intensity, TDCS has been demonstrated to modify perpetual motor and cognitive functions reversibility in healthy subjects. The stimulation duration of cortical excitability underlies changes induced by TDS differ between those seen during and after stimulation despite the neurophysiological effects. A study was done by Diamond and his colleagues was done to investigate the intercortical current flow between pairs of small scalp electrodes. The results suggested that approximately 45% of the current applied passed to the brain. Different negative symptoms were produced through giving anodal TDCS over the left dorsolateral prefrontal cortex and cathodal above the supraorbital region. Clinical scores were assessed with positive and negative symptom scale and scale for assessment of negative symptoms, also known as SANS. A study was conducted where 20 patients with predominant negative symptoms were recruited and stable medication was given out for 3 weeks and were randomized to be in an active or sham group. 2 MA TDCS was delivered 10 times within weeks 1 and 2 along with functional connectivity of MRI which performed before and after TDCS. MRI showed a significant deactivation cluster in the anatomical regions of NCL, accumbens, subgenual cortex, and stratum. The authors of the study concluded that TDCS is a promising tool to improve various schizophrenic symptoms that are otherwise often difficult to treat through medication. Medication could not explain the long-lasting effects in the reduction of the hallucinations and other symptoms. This means that the effect of TDCS on the reduction of hallucinations was evident. Researchers such as Gandia et al. Have supported research that found that neither healthy volunteers nor patients were able to distinguish between TDCS and SAM sessions. Significant reduction of negative symptoms with TDCS suggests that activation of the dorsolateral prefrontal cortex using invasive brain stimulation could correct frontal limbic imbalance. Further predictions were made that the effects of TDCS on negative and depressive symptoms are a result of the nodal TDCS acting on frontal hypoactivity, and the effects on the auditory verbal hallucinations are a result of the cathodial TDCS on the temporal junction acting on temporal hyperactivity. Also, it suggests that TDCS is an easy to use, low cost stimulation tool with few other side effects.